55% of people are never going to fully recover from a car accident. 30% of them are going to be chronically impaired. 30% are going to be chronically impaired. Why? Because the injuries are never found. If the injuries are never found, you can never rehab them. You can never live a full life, a full expression of life.
Welcome to the True Health Solutions podcast. I'm your host, Dr. Lonnie Bagwell, stress, inflammation, and functional health clinician.
And I'm your co-host, Brigitte Spurgeon, metabolism and nutrition expert.
This podcast is where we bring hope, truth, and inspiration for your holistic health journey.
Because the world needs the best version of you.
Hello, and welcome to True Health Solutions podcast. I'm your host, Dr. Lonnie Bagwell. And with us today, we have a special guest. He's a friend. He's a colleague. We work together every day here at True Health Center, helping patients from all different backgrounds, walks of life. Actually, they fly in because of a lot of the advanced work that you do from all over the world. But today we're going to be talking about something that relates to everybody, which is the most common types of injuries that we would see with someone who has any kind of trauma. So today with us, we have Dr. Justin Dick. He is, again, he's a friend, he's a colleague, but also he's actually a world-class, most people wouldn't know this unless they had scoliosis, but he's a world-class corrective care chiropractor that helps correct scoliosis without the use of any types of surgeries. That's something that one of the things we're most proud of here in the office is the advanced training that we've done in different specialties, and that's his, and he truly is world-class at it. I always say he's top 10 in the world at being able to help people reduce scoliosis, which does tie into what we're talking about today, Doc, because whenever I remember when you went and did your advanced training for the trauma stuff that we're talking about today, and I remember you coming back and saying it was awesome, and of course I learned a bunch, but it's already stuff we've been doing. And with doing the advanced corrective chiropractic that we do, you were like, we're already teed up for this. Like, this is the stuff we've been affecting for a while, and we were able just to kind of go next level with it. And so anyway, I guess just for our viewers' sake, tell us a little bit more about, what we would say is mechanism of injury. Okay. So as far as like, what are the different ways that people can, because most people might say, okay, car accident, 55 miles an hour, that makes sense. But what are all of the ways that our listeners would help, what you can help them understand for themselves and their families? How do they, what does trauma mean?
Gotcha. Right? Great question, Dr. Bagwell, and thank you for having me on. This is a super important topic that, in my opinion, is heavily missed. Through my postdoctorate work, like you and I were talking about, it's something we do in the office every day, and it's missed in almost every practice I've ever seen. And this is the reason why we get consistent results here in the office, is we don't miss these traumas. Now, these traumas can come from almost anything. When I say trauma, it doesn't mean I rolled my truck 4 times. It doesn't mean I was in a plane accident. A trauma, it means, hey, it could have been something small, but that small thing is built up and built up and built up. And all of a sudden, now we have a long piece of traumas in there. It could have been, I picked up my 3-year-old and he jumped on my neck. Something very small, very insignificant in most people's eyes, but all it takes is 10 pounds of pressure of what we're going to be talking about here in a minute, 10 pounds of pressure to create this damage. And when this damage happens, it's irrecoverable. The body doesn't recover without intervention, such as what you and I do here in this office.
That's perfect, man. That's a great explanation. And you made me remember when I was learning about the different traumas in school, we talked about there's even traumas that are called repetitive stress traumas. And the example that was always given to me was that person that bags the groceries or maybe rings up your groceries. And then after 10 years of working at the cash register, they literally get a repetitive stress trauma to their shoulder. So trauma, in summary, there could be a slip and fall on the ice. It could be picking something up wrong. It could be sitting at your desk, frankly, for the last 20 years, right? And the wrong ergonomics would be repetitive stress trauma that absolutely would impact ligaments, which we're going to talk about here in a minute, all the way up to the fender bender, to the 55-mile-an-hour accident, to my parachute didn't open when I did my first jump, right? Okay, so anything in the middle, right, would fall into that category of trauma. And so when we have traumas of various kinds, okay, we need to simplify this for everybody. And so, and one thing that was actually surprising for me to hear, even if it's something that maybe clinically you work on every day, for someone just to tell you that there are only 3 ways that you can get an injury to your joints, right, to your spine. What are those 3 ways? Like that was, I was like, yeah, you know what? You're right. There really are only 3 ways. And of those, there's really 2 categories of those 3 ways. So walk everybody through, keep it simple so that they can understand that whatever trauma they've been through, it's going to go into 3 different categories.
Gotcha. And these 3 categories are the basis of what we do in this office. The foundation of my advanced program, my advanced stuff, my scoliosis, where people come in from all over. This is the foundation. So we're going to give a real quick overview of what can happen. And really, as a whole, like Dr. Bagwell said, there's only 3 main traumas the spine can have, right?
Yep.
So there's hard tissue and there's soft tissue. Hard tissue is bone and soft tissue is everything else. Mm-hmm. So as a whole, medicine is only concerned as a whole with hard tissue. So you have 34 vertebrae in the spine. There's 34 vertebrae. If something happens to those vertebrae, if you fracture a vertebra, that's when medicine comes in. You're in the best place in the world for that. However, when you start to get into soft tissue work, this is where medicine kind of doesn't actually catch a lot of these injuries that we're talking about. Mm-hmm. So 34 vertebrae could be fractures. There's 220 spinal ligaments you have. 220, right? So of those 220, 23 of them are discs. Everybody's heard the word disc. Everybody knows what a disc is.
Right. Everybody knows what a disc is. Yep.
Everybody knows what a disc is. But there's 197 other ligaments that are supportive of your spine besides the disc. So 23 discs. Discs are very easy to find, right? We have great imaging. We have MRIs for imaging. More importantly, disc symptoms per consensus, per American Medical Association standards, go ahead and Google it. Go look at Medscape. Discs create pinpoint pain, so pain right in the center of your back, or pain that goes down your arms or legs.
Right.
So
that's called radiculopathy, right? Radiating
you got
pain.
It.
And that's what most people are familiar with when they hear about disc. They think about that burning, shooting, electrical type pain.
You got it. You got it right, Dr. Bagwell. So if you have an injury, you can break your back, you can break the vertebra, or you can have disc pain, which is that pain in the center and pain that goes down your arms or back, what Dr. Bagwell said, this radiculopathy. Mm-hmm. But if you have any other symptom, it's a result of these other 197 ligaments. Any other symptom could be very easily, it could be shoulder pain, it could be bladder bowel problems, it could be headaches, disturbances in concentration, it could be ringing in the ears, which we hear a lot of, called tinnitus. It could be headaches back here, sinus problems, fatigue, mid-back pain, low back pain. It can also be troubles breathing. It can also mimic a disc, which is mid pain and pain that goes down your arms or legs. It can be almost anything.
Yeah. And this is huge. I'm just going to pause here for 1 second because what we're telling people right now, and this is so good because the world of pain is perceived to be, and it's experienced to be complex because when you're in pain, you just want the pain to go away, and you can go to any, I can get stretch now, massage therapist, physical therapist, medical doctor, chiropractor. Like I can do all these different things. It gets really complex for the patient really quickly. But what we're saying is look, if it isn't fractured, and if you don't have a herniated, I'm recovering from laryngitis. No better time to record a podcast. Anyway, so when you're, so you could have a fracture, you could have a disc injury, but that is in the large minority. That's high, that's very unlike the high majority of people who are having some kind of joint pains or whatever. It's this soft tissue stuff that we're talking about. Now, is it true that the bones, that those ligaments and such are attached to bones, and so you have to affect the bones in order to help heal the ligaments? Yes, we do that every day, right? But as far as getting to the bottom, and we're all about getting to the cause of the pain, if you don't know that there's 3 types and really we're looking at one major thing, then you're never going to see it. And the reason why I can say that with such conviction is because that is the medical model, right? I mean, that they miss it. They don't even care about it. I mean, I hate to say it like that. And I'm not saying that people don't care about patients. I'm not saying that, right? But the system is set up to not really give an emphasis to or care about that, right? Because, and this is how again, we've seen tens of thousands of patients together, right? So when they go into the ER or the urgent care after an accident, for example, right? You don't have any fractures. Your disc seems to be intact, or maybe they'll just say you're not showing any disc related type symptoms. So, and then they say the same thing, you're lucky, right? It wasn't worse, making it kind of downplaying, right? That you got the light thing, right? Which is, we're talking about, this is the number one cause of pain for people. And so, and they're saying you didn't, it wasn't as bad as it could have been. Sprain, strain, here's some muscle relaxers, here's some anti-inflammatories. Am I right?
Yeah, and that's unfortunate. That's exactly right. It's exactly right. It doesn't mean that there's nothing going on.
No.
Again, so for these injuries, these 3 injuries we're talking about, you're talking about if you break your back, you're talking about an X-ray or a CT. For a disc injury, you're talking about an MRI. But the injuries that you and I are talking about, Dr. Bagwell, today cannot be found on MRI. They cannot be found on CT. They cannot be found on X-ray. However, these are typically at least 30% of the people that walk in this office, Dr. Bagwell, 100% of scoliosis cases I have in this office have this injury.
Yeah.
And 30% of them, at least 30%, are rateable for surgical findings already.
Right. I would say, and just to clarify that statistic for everybody, I would say with as much abnormal curvature, lateral curvature, decreased curvature, and history, I would say 30%, I agree with you, 30% that walk in the door with pain, like active pain right now, have this problem. But honestly, I mean, you look at all the same x-rays that I do, I'd say almost 100% of people have this problem from some point in their history, right? So it wasn't the accident. They didn't have an accident last week. They had an accident when they were 16 or 17 years old, and then they've been sitting at a desk for 20 years. And now all we're doing is dealing with a far more complicated and frustrating, recovery process than if we had gotten to it 20 plus years ago, right? So just so everybody's listening here, we're literally talking about cracking the code on why everybody's having so much pain. And if you're listening to this podcast right now, either you or someone you know has pain today or will within the next 7 days, whether it's the headaches, whether it's hardly ever on the very low end of the spectrum, do we take an x-ray and we don't see something, meaning that the cause of their pain is happened in the last, week or month. Rarely ever, hardly ever. Right. I mean, if someone falls and they come right in, get in a car accident, come right in, and they have no history. Now we're talking about a small percentage of people, right? Then in that case, it might be just an acute, injury. It could be that simple sprain, strain, et cetera. But almost always with what we see, we get people coming in here, even people who come in for wellness, they'll say, well, I'm not really having any symptoms right now. Then we'll take an x-ray, and there's ways that on x-ray we can identify that there's ligament instability, and all of a sudden the vertebrae are not stacked right. They're all over the place. And we're like, oh my gosh, like what happened? You said you didn't have any trauma, but clearly there's some trauma here. And then, I forgot to tell you. I mean, I didn't think it was a big deal. I got in an accident when I was 20, right? It was only 5 miles an hour.
Every patient.
Right. It was only 5 miles an hour. It was only 10 miles. But while the medical community continues to reverse educate people and just downplay the number one injury that we're seeing, that we deal with on a regular basis, we have top universities like Yale and Harvard and they're putting out the research that's saying, hey, if 9 miles an hour or less, the car may show no damage. And 80% of the time, that person has some kind of torn or damaged or sprained ligament, right? Even if they don't have any symptoms like that last. And so the research it's convincing, if you have some kind of a trauma, if you've ever had a trauma, you need to have it evaluated before things get too degenerated. If you, and if anybody has an acute trauma, you need to get seen right away. And there is a time scale on that, right? Yeah, you might know some statistics or facts on that, but do you know, and I'm putting you on the spot here because I don't know this for sure, but is there a difference between someone who comes in, let's say in the first 72 hours versus someone who waits 3 or 4 weeks and then comes in?
Boom, you hit the nail right on the head.
Okay, good. I thought I was in the right
3 days are perfect.
Okay.
After that, the restorative factor drops off, and it starts dropping off almost exponentially once you get to 3 weeks. So the first 3 days, if you're in a car accident, if somebody jumped on you, or who knows what kind of trauma that you had, you have 3 days to actually get in and get it looked at to start restoring function.
And I will just a side note on that you made me think of there. You are incredibly accommodating with that. You do better at getting people in fast than I ever did. Actually, you've bent over backwards and sideways to make sure that people can get in immediately. And now I know more why. Actually, there's a little bit of motivation behind that, not just being a nice guy, right? Trying to help people out, but actually being able to help them maximally there. That's awesome. I think that I like the idea to help. I think people need to understand and really solidify understanding what type of like the structure, function, and injury that we're talking about. So the analogy or the whatever you want to call it, the depiction that I thought was helpful for me was just walking them through what a knee's like. Do you want to just walk them through like the kind of like how we're talking about this ligament damage and how it relates maybe to a knee, things that they hear about every single Sunday or Monday if they watch football, right? We got an ACL tear,
Gotcha.
we got 17 of those last Sunday, right? We got meniscus tears. So walk them through a knee, help them understand what we're talking about here, and then we'll dial it back into the spine.
Gotcha. So a really good analogy. Structure determines function in almost everything in life, right? So if we have proper structure, then we're going to have proper function. So if we're using a knee analogy, we have meniscus. Everybody's heard of meniscus, right? We have ligaments that are on either side of the knee. We have ligaments on the inside of the knee. And especially when you get into like football and somebody's taking it out with the knee, we hear meniscus tear or lateral ligament tear. We hear all these different tears. And we know when this tear happens, or even when it's sprained, you're not going to walk anymore, right? They get carted off the field.
Right. I was just going to say, like that ligament, it may not even be torn, right? So a running back goes down and they say, oh, and they show the replay and they say, oh, look what happened to his knee, and everybody's stomach turns a little bit, right? And then they don't let him walk on it, right? They don't know if it's torn or not. And more often than not, they come out of the game and it's not torn. That's the reality of it. You don't hear a lot about that on Monday or Tuesday of the injury report because it wasn't torn, right? They'll be back quicker because it wasn't torn. But they literally treat it like a major injury, like a significant and major injury. Yet that exact mechanism, that exact thing is happening every single time. If you fall, if your kid bounces on the trampoline wrong and lands wrong, right? They're doing gymnastics, they're doing sports. That is not treated as an injury at all. It's almost like it puts the athlete on the spot, or the parent that has to go back to work on Monday and provide for their family, whatever it is. It kind of puts the injured person on the spot to say, I just need to step it up and keep pushing, right? I have stuff I have to do. I don't have time for this. It's literally minimized. We do it as a society. We minimize this type of an injury. Whereas,
Doc, when getting back into that football analogy, right now is a hot topic, right? Tua was just carted off the field, had some massive issues.
Well, yeah.
This is the exact same injury that we're talking about. This has neurological components, which he had. This has dermatomal components, so the skin, what it feels like, the muscles, what it feels like, as well as excessive motion. This is the exact injury that we're talking about that we're finding on day one when you walk in this office. You have to find this injury. If you don't find this injury, you're walking right back into a disaster. You're going right back on the football field. You're going right back to work when you shouldn't be playing. You shouldn't be at work. That's how important this is. If you don't find this, essentially you're just creating more damage every time you go back into play, every time you go back into work. You have to find it on day one to actually help it recover.
And for anybody like us that works with the nervous system on a daily basis, those videos are devastating to watch. Like Tua. And I mean, but you know what? I'll tell you, if you're a listener, I almost wasn't even going to say this, but I'm going to have you do it anyway. If you're a listener and you have not seen, go to YouTube and look at Tua's injury. So it's just a concussion for the quarterback for the Miami Dolphins. You can understand how structure dictates function, because when he went back and his structure changed, right, in that impact, just like a whiplash injury in a car, and that impacted his nervous system, that soft nervous system tissue. You can literally see where he couldn't actually move his hands, like his uncontrolled contractions of his hands, right? Completely out of it. And what most people don't realize is that because no one was there to watch it and film it. So this kind of stuff on a smaller scale happens with all these traumas, but because you can't see it on the inside, or because no one was there to quote film it, right? Then we just kind of brush it off and keep moving. And so to your point, the damage is done and it's only going to get worse because then we kind of brush it under the rug. We got to get back to life or whatever. So you got to take this stuff seriously. And what got us talking about that is, even if it's a 5-mile-an-hour fender bender, right? The cars have been created to not show damage up to a certain miles per hour, but that does not mean that your human body, that's bone and flesh and all that, did not sustain some kind of significant damage. So, and I do stress significant damage because even at 5 miles an hour, we get people coming here. I mean, their head was turned sideways and they tear ligaments that lead to things like impairment ratings and disability ratings. And that's the other thing I want to say. And you're an expert on this. I'm not. You're the elected official in the office to determine these things. All right. But people need to understand this too. When we say that it's serious, it's not because Dr. Justin and Dr. Bagwell think that it's serious. It's because it's the standard. According to the American Medical Association, according to our medical society, everything, it's the standard that it's a serious injury every single time. So why we don't act in accordance with that as a medical community is beyond me. But to understand how serious this type of injury really is, and how, and why people, and to understand why you're having pain now, even though you haven't had a trauma for 5, 10, 15, or 25 years, I think we can speak to that with talking about the impairment rating. So walk everybody through how that gets determined. Like the qualification for it seems like it's so minimal, compared to what we see on a daily basis, and then ultimately disability.
Gotcha. It's a great question, because unfortunately, we as a medical profession as a whole don't understand this very well. So what Dr. Bagwell is talking about is the American Medical Association has set standards apart. If you meet this qualification, these are objective findings, which means these are measurable findings. Again, it's not Dr. Justin or Dr. Bagwell here. These are objective findings, measurable. So you can take this stuff and you can go to any other doctor. If you meet these qualifications, you are X amount impaired. And so 30% of our patients that come in are 18% impaired when they come in. That's when they come in based off a trauma that has happened previously. Now, if you come in and it's within the first 3 days and we rehab that, then you're not impaired anymore. But, based off the DRE, what every doctor in the world has to follow, we put our standards up against it. We find on day one from those injuries, and we can say, here's what you qualify for. This is where you're at in the medical model. Mm-hmm. These are impairment ratings. It's the same impairment rating as if I cut your arm off. This goes to those same guidelines. This is objective findings. You cut your arm off, you have how much of your life can you function in? The exact same thing. These are the injuries that we're talking about that you can't find on MRI. You can't find on CT. You can't find on X-rays. But when we do find them, we can quantify them and put them up against these standards that are in the American Medical Association DRE standards and say, here's where you are right now. But you're not always going to be like that. You don't have to be like that. We can help you here.
And we use that as a baseline standard, and then we can reassess the same way that we uncover the impairment ratings and check those boxes. We can uncheck those boxes as we're doing appropriate care. And that's, one thing that kind of sets us apart is it sets us apart is because we're getting to the cause, we're determining the impairment rating, and then we know how to target bringing them back to full function so that they can get back to as close to optimal function as possible, which ironically is almost always better than however they were before the accident, right? Because because we have this accumulated stress in our life and these traumas and stuff, right? That have us operating less than and to some degree impaired. And so our goal is to get people better than they were before the accident, not just to maximum medical improvement, which would bring you back to where you were at the time of the accident. In fact, that's my story, by the way. I'm a chiropractor today because I got in a car accident and I felt better after 3 visits than I did before. I was an athlete. Whatever percent body fat, like I was in a healthy state before the accident. And after getting adjusted just a few times, I felt better after getting adjusted than I did before I ever even was in a motor vehicle accident. So, and that's what we're doing. Again, everything we do here is something that we've experienced at some point in our lives. And that's my story. So, what you kind of started to allude to how we're different. And that's the thing I want to walk everybody through now. We kind of talked about how the medical model approaches this whole thing. And it's a little frustrating. It's really frustrating actually for us to see how people have been handled when these things happen. Walk people through kind of what, just generically, you don't have to get into the super details of it because there's a lot of detail, but generally walk people through how do you come up with an impairment rating, and what are some of the things that we would be doing to help people improve that might be different than somewhere else?
Gotcha. Good question. So we'll start with somebody walking in the office. When somebody walks in the office, we have to do a full workup on them, right? You can't just walk in the office and say, well, I feel good today. Well, feelings are kind of a liar, right?
Sure can be.
You don't feel a heart attack until when? You don't feel cancer till when? So how you feel isn't necessarily exactly how healthy you are. So when you come in the office, we're going to do a workup. We're going to take stress x-rays. We're going to find out how well your body's actually functioning.
Mm-hmm.
When we get into functioning, now we're talking about, okay, now we can compare them against standards. So we have stress x-rays and we have functioning standards. These are objective findings again, Dr. Bagwell. These are against everything else. It doesn't matter who does it. These are objective. Now we can compare them against the impairment ratings. And we can look at those impairment ratings and say, here's where you're at today.
Yep. And give everybody just
every
an example.
doctor in the world knows that, but it doesn't mean that's where you have to stay.
Right. Amen. And that is always the message of this office. You can do far more than anybody's ever allowed you to believe, including yourself in a lot of cases. What are some of the things you look at? Like we look at posture, we look at range of motion. We even use on the traditional side more of a bilateral weight scale. Obviously, we're taking x-rays, we're doing flexion and extension films to assess for your joints' ability to actually move properly through different ranges of motion. What are some other things that we would do on that front end to get, like, what are the ways that we achieve those objective measurements?
Gotcha. Good question. So when you're looking at the DRE, you're looking at impairment, you're talking about those flexion extension x-rays along with symptomatology. Do I feel like this? Is this radiating here? And you're also looking at neurological symptoms. So neurology, everybody thinks of neurology of just their brain, but the neurology controls absolutely everything in your body. Every organ, cell, tissue in your body controls absolutely everything. Those nerves that go to your heart also go to muscles. And so we can do muscle testing. Is one muscle weaker than another? Okay. Does that correlate with our x-rays? The different skin area correlates with our neurology. Okay. Does that correlate with x-rays and symptoms? We put all this together, testing the neurology, both muscles, both skin, and x-rays. Now we actually come out to be objective findings of where do you stand.
There you go. That's perfect. Yeah.
Now,
people
what do
don't
you
realize
do with that? It's the big question.
Yeah. But people that, absolutely. When people come in, a lot of times they're blown away when, they'll say, I have this feeling like just in these digits right here is where I feel numb, and right away it's like, okay, we know the C6 is a problem. And they're like, well, how do you know that? And it's because of these dermatomes, myotomes that you're talking about right now. Like, so it's incredible. The nervous system creates this map, and that's what we do. That's what we're trained in, is to kind of memorize all those maps so that really quickly on the fly, we can start to zero in on things. Otherwise, we'd have to take 600 x-rays and MRIs and all that stuff, right? We'd be exploratory imaging, but we have to be smarter than that. So that's perfect. And then, let's go back to the knee analogy, right? So the ligament's damaged. What do? Well, that knee's really, I just think about the rehab protocols. I follow a lot of sports. The rehab protocols for a knee injury, a sprain strain, are extensive. That week, the next weeks to come, they might be 4 to 6 weeks out of their activity. 4 to 6 weeks out of their activity, and they're rehabbing for 3 to 4 hours a day minimum. And they had to change their whole lifestyle around it, right? So we have the luxury of, we don't have the luxury of having patients for 3 to 4 hours a day. Otherwise, we certainly could rehab quicker, right? But we do have the luxury of being working with the spine. We have advanced things here in the office that we can do. What are some of the things that we most often do to help someone rehab as fast as possible from these types of injuries?
Gotcha. I'm going to go right back to structure. Structure determines function. If you don't restore this structure, every doctor in the world knows what the spine's supposed to look like. But very few of us in medicine, as chiropractors, as medical doctors, they're never taught what an injury to the spine actually looks like, right? So if you injure the spine and the structure is not there, what are you going to do about it? So if we know if the spine looks like it's supposed to, you're going to function appropriately. But if we don't put it back there, you're not going to function appropriately. So we're going to start number one with restoring the spine and the structure and building the rehab around it to get it to actually hold appropriately. Structure determines function. If you're in an airplane, you fly somewhere, that's a different structure. If you're in a car, it's a different structure. You would have driven there. If you have a bicycle, different structure. Same exact thing happens with the spine. If you have these injuries, you're gonna change the structure. Unless you actually change the structure back, you're never going to fully rehab, ever.
Right. No, that's perfect, and that's the foundation of our office. That is the thing that sets us apart. A lot of people will say, and it's all in good intentions. So there's no judgment here at all. But a lot of friends will tell friends, oh, you got to go to my massage therapist. And we love massage therapy. We use massage therapy, right? You got nothing against it. But if that structure is off underneath, you can work that tight muscle for the next 10 years and it's not going to change. As I tell people all the time, like, so get the structure corrected. And then now this might come as a surprise. So, well, let me say physical therapy, kind of same thing, right? They're really focused a lot on the soft tissue. And I work with a plus physical therapist for some of my physical therapy needs, advanced PT needs. And he's 100% on board with this. Like, we have the conversation all the time. Structure dictates function. He gets it. He agrees with it. He knows his lane. We know our lane. It's a great relationship, and he's been great to be able to help us. But he understands, like, you can't just run to the PT and you have a scoliosis, an extreme example, right? Like that, you're not going to PT that back, right? And as long as the scoliosis is there, you're going to keep having muscle and soft tissue problems, ligament problems. But this might come as a shock to listeners, not to our patients if they're listening, they get it. But chiropractors, 98% is the number that hasn't changed in 15 years. 98% of chiropractors are going to not change your structure. They might push on the bones and the joints, right? They might help get people relief, and they might do a lot of soft tissue work even in some cases. But people don't realize, they think, okay, chiropractors are the ones. It's not even just chiropractors. It's actually only about 2% of chiropractors actually change the structure underneath, which of course is what we do and what we focus on with all of our advanced corrective care things that we do. So with that said, just give people an idea. Pick your two favorite modalities or extra things that we might do for someone who had a trauma of some kind or in a car accident that have consistently produced reduction in their symptoms, but also restoration of their health. Obviously, we're adjusting, we're fixing the structure. Pick your top two favorite things on top of that.
Gotcha. This office offers restoration of care, which is great. Structural correction, which is the foundation of almost everything chiropractic was founded on. Chiropractic as a whole is founded on. So our advanced program here actually allows us to do that, not just say we do it, like many different doctors in this world say we do it. No, we actually do it. Objective findings before and after. So this is what you look like before, this is what you look like after. So we're going to prove it. Good, bad, or ugly, we're going to prove these are actually the changes that are made. I'm not going to hide from our results here, which is a distinction in itself. Chiropractors, doctors as a whole are really good at charging for that X-ray at the beginning. They're really good at charging for care. But when you do follow-ups, there's never any follow-through of did we actually get better. But as far as modalities in the office, this office has some amazing tools, lots and lots of different tools. We spent thousands and thousands and thousands of dollars in rehab just to make sure that we are best for you. And the office will never look the same from today to 6 months from now, because we're going to get the next best tool that's best for you. I mean, we spend infinite number of time researching and getting into stuff for you. One of my favorite things is a vibration. 30 hertz vibration retrains the brain and the body of where you're at. There's lots of really good healing, releases hormones that helps you heal. It has recovery for healing. It increases your lymphatic flow. Lots of healing process just with
metabolic
vibration.
Function. I mean, the vibration is amazing.
It's just an amazing tool itself. So if you're injured, if you're a patient existing already and you're injured, if nothing else, let's come in and get you on the vibration platform just so you can start healing.
Let me chime in on that real quick because vibration platforms have become more popular. And so it is also my favorite thing that we do up and above. And people nowadays, patients are even coming and saying, I have vibes at home and everything, right? And chiropractors have started to add those to their suites, to their rehab suites. But two things I want to say about that. One is, even if it's as simple, the lowest level of vibration that we use is a vibration plate, which is the highest level that most people use, if they use it at all. But it has to be a specific hertz. I just want to say that, because otherwise our listeners are going to run out and they're going to order on Amazon. It's Prime Week right now while we're recording this. They're probably going to find a vibe plate for $300 off. Anyway, so it's got to be a specific hertz. That's number one. But the other thing I wanted to say is that we take vibration to a whole other level. So those ligaments that are damaged, there are a few things on the planet, almost nothing, that can actually help a ligament recover and heal, right? but it's a specific frequency of vibration that actually can take the damaged ligaments and actually draw them back together and increase their tensile strength. And so we actually have vibration that can go under your neck. We have vibration that can go under your mid back. We even have that vibration we can then place from the neck into the low back. So we actually have specific hertz vibration that can help rehab ligaments. And why the medical community and PT community does not use these advanced forms of vibration for specific ligament rehab is mind blowing to me on one end, but on the other end, it's the purpose of this whole podcast and video that we're doing, because they're just ignoring it. They're just choosing not to address the number one cause of people's issues. So I love that. I'm glad you said vibration, because that's something I'm always excited about too. And we actually offer that for every single patient. Every patient does some degree of vibration that comes through the door. This is awesome. Gosh, I feel like this is just the beginning of this discussion. We need to do more podcasts on this. But in summary, just real quick, if you have ever been in an accident or you know anybody, you need to share this podcast with anybody who gets in a car accident for sure. Don't even think twice about that. It should be, are you okay? I'm sending you a link, because people have to be armed and have to be ready to do the right thing quickly when it comes to this stuff, right? You got to be proactive, but some people aren't going to know, and then they get in an accident, right? So you got to be urgent about it. But also, if anybody's listening to this and they've ever been in any kind of an accident, I can't come up with a realistic reason why you wouldn't be evaluated by someone who's an expert on understanding, like, why are you having all these issues, right? Like getting to the root cause, looking at ligaments that no one else looks at and are most often ignored. One of the statistics that I wrote down here beforehand, and I just want to say this before we sign off on this podcast, 55% of people who've ever been in an accident have some degree of impairment and ligament damage, right? So that's more than half. So if you have a family of 4, right, and then it's likely that almost everybody's been in some kind of a auto accident or some kind of a trauma. So there's a 50-50 shot that someone has a more advanced issue going on, and it is the cause of their symptoms. But the other thing is that one thing we didn't talk about that I want to mention is when you don't address these issues. We talked about quick is better, and it gets harder over time if you don't address it. Now, if people don't address it at all, or they wait decades before they get to it, the real number on this, which is crazy, because it makes me feel like we should charge more. No, I'm just kidding. The real number on this is that people will spend as much as, I'm going to read it right off my notes here, as much as $9,000 to $19,000 per year just managing the long-term effects of ignoring the effects of these traumas. That's how it's worded. So $9,000 to $19,000 per year, that's money out of pocket. That's inconceivable to a lot of people until you get into these chronic pain issues, getting joints replaced, getting spines fused with surgeries. Then it all of a sudden starts to make sense how that bill can get racked up so much, because it's never just the surgery, right? It's the rehab that comes afterwards. It's the years of rehab that comes afterwards. And so it ends up piling up to be as much as, an average of whatever that is, $12,000, $13,000 a year. That's $1,000 a month to manage something that could have been handled a lot earlier, and not to mention the quality of life. So any comments or thoughts on any of that stuff, Doc, before we sign off of this episode?
No, I think you hit some key points there. 55% of people are never going to fully recover from a car accident. 30% of them are going to be chronically impaired. 30% are going to be chronically impaired. Why? Because the injuries are never found. If the injuries are never found, you can never rehab them. You can never live a full life, a full expression of life, right? If you have a family, you can't afford to be down. You can't afford to be in pain.
The whole purpose of this podcast is to give people a different map. We always use that analogy in our workshops and stuff. But if you keep pulling out a map that takes you from here to Florida, but your goal is to get to New York, you're never going to get there. So the purpose of this is to give them a new map, a new understanding, just new information in their head to be able to say, wait a minute, I can do things differently. And we're giving them the map to New York, right? Man, this was awesome. This was fun. We could talk about this stuff for 6 hours. Make sure that you're sharing the podcast. If you have questions about this, if you're concerned about your own health, you can always reach out through Facebook, to the office directly. As always, all of our links are below. You can actually schedule 15-minute consults so we can talk personally about your case, myself, Dr. Justin, Brigitte, whoever, depending on what your needs are. So make sure that you're tuned into our next episode. We are going to hit this more. We're going to go deeper with this for sure, because people need to hear more about this. So be on the lookout. If you like this topic, be on the lookout for more episodes just like it. Otherwise, we love you. Thanks for tuning in, and we will talk to you next time. Thanks for joining us, Dr. Justin.
Thanks, Doc.
Thanks for joining us today on True Health Solutions Podcast. Make sure that you click to subscribe. Also, go to our website, www.truehealthcharlotte.com, where you can download any resources related to today's show or any future shows. And lastly, if you search for True Health Center Group on Facebook, you'll be able to join our free health community. We look forward to seeing you there.